Many seniors take medications daily, but did you know some commonly prescribed drugs may actually harm your health as you age? In today's episode on Wellness 60 to 100, we uncover 7 medications that could undermine your healthy aging goals. If you're over 60, this is vital information you can't afford to miss. At 74, Mr. Thomas Reed had always prided himself on staying active and sharp. He walked daily, ate well, and visited his doctor regularly. But over the past year, he began to notice troubling changes. He felt groggy in the mornings, his balance was off, and he occasionally forgot conversations. His family grew concerned when he fell twice in 1 month. Thinking age was simply catching up, they didn't push for answers. But during a routine checkup, a new geriatric specialist reviewed his medications. Shockingly, several of them, originally prescribed for anxiety and sleep, were known to cause cognitive decline and dizziness in older adults. Adjusting his prescriptions brought a dramatic improvement. Mr. Reed regained clarity, energy, and stability. His story isn't rare. Many seniors experience side effects from medications that weren't designed with older bodies in mind. The issue isn't just the number of drugs, but the specific types. Some that were once helpful can become dangerous over time. Sadly, these effects are often misattributed to aging rather than medication. That's why it's crucial to understand which medications may pose risks and what alternatives may be safer. In this video, we'll uncover the 7 most concerning medications for seniors, backed by expert medical insight. I'm Dr. Emily Carter, a board-certified geriatrician with over 20 years of experience helping older adults maintain their health, independence, and quality of life. I specialize in identifying age-related risks, especially those linked to medications, and guiding patients and families through safer, evidence-based treatment plans that support healthy aging and well-being after 60. As we grow older, our bodies become more sensitive to certain medications due to changes in liver function, kidney performance, and overall metabolism. Unfortunately, many commonly prescribed drugs can pose serious health risks for seniors, leading to falls, confusion, dizziness, or memory issues. Some of these medications are still routinely given without fully considering their long-term impact on aging adults. In this video from Wellness 60 to 100, we'll uncover 7 medications that may be harmful for people over 60, explain the reasons behind their risks, and suggest safer options. Understanding these risks is a crucial step toward healthy aging, ensuring better safety, mental clarity, and overall quality of life. Benzodiazepines, often prescribed under names like diazepam, Valium, lorazepam, Ativan, or alprazolam, Xanax, are commonly used to treat anxiety, insomnia, or panic attacks. While they may offer short-term relief, these medications pose significant risks for adults over 60, and those risks are frequently underestimated or overlooked by both patients and healthcare providers. In older adults, benzodiazepines are metabolized more slowly. This means the drug stays in the body longer, potentially causing stronger and more prolonged effects. One of the most serious concerns is increased risk of falls. Benzodiazepines can cause drowsiness, slowed reaction time, and balance issues, all of which dramatically raise the risk of dangerous falls that could lead to fractures or hospitalization. Memory and cognition are also affected. Seniors taking benzodiazepines regularly may experience confusion, forgetfulness, and even symptoms resembling early dementia. These changes are often subtle and mistakenly attributed to normal aging, which delays proper intervention. In fact, long-term use of benzodiazepines has been linked to a higher risk of cognitive decline and Alzheimer's disease in multiple scientific studies. Dependency is another major issue. Many seniors who begin these medications find it difficult to stop, especially if they were not warned about the potential for withdrawal symptoms like rebound anxiety, agitation, and insomnia. Gradual tapering under medical supervision is often required, but not always initiated in clinical practice. So, what are the alternatives? Cognitive behavioral therapy for insomnia, CBTI, has been proven more effective than sleeping pills for long-term sleep improvement. For anxiety, techniques like mindfulness, gentle exercise, or selective short-term antidepressants, under close monitoring, can be safer options. Always consult a geriatric-informed doctor before starting or discontinuing any medication. Recognizing the dangers of benzodiazepines for seniors is a crucial first step toward protecting brain function, mobility, and independence. If you or a loved one over 60 is currently using these drugs, it's worth having a serious conversation with your healthcare provider about safer, evidence-based alternatives. Anticholinergic medications are a broad group of drugs used to treat conditions like overactive bladder, allergies, motion sickness, and even depression. Some common examples include diphenhydramine, Benadryl, oxybutynin, ditropan, and amitriptyline. While these medications serve various useful purposes, they can quietly wreak havoc on the aging brain, and many seniors take them without knowing the risks. These drugs work by blocking acetylcholine, a neurotransmitter essential for memory, learning, and muscle control. In younger adults, this might only cause minor side effects like dry mouth or mild drowsiness. But in seniors, especially those over 60, the consequences are far more serious. Studies have linked regular use of anticholinergics to increased confusion, delirium, and even long-term cognitive decline. In fact, research shows that seniors taking high anticholinergic burden medications for extended periods may have up to a 50% increased risk of developing dementia. Worse yet, many of these drugs are sold over the counter. For instance, diphenhydramine, commonly found in nighttime sleep aids and allergy pills, seems harmless, but it has strong anticholinergic properties. Seniors who take it regularly for sleep or allergies may unknowingly be contributing to worsening brain function over time. Other effects include blurred vision, constipation, trouble urinating, and increased heart rate, symptoms often mistakenly attributed to aging or unrelated illnesses. This overlap makes it even harder to identify the drug as the root cause. Fortunately, there are safer alternatives. For allergies, non-sedating antihistamines like loratadine, Claritin, or cetirizine Zyrtec are usually better tolerated by older adults. For overactive bladder, behavioral therapies and pelvic floor exercises can offer meaningful relief without the cognitive cost. And for sleep, non-drug strategies like sleep hygiene and light therapy are both safer and more sustainable. If you're over 60 or care for someone who is, it's important to review all medications, including over-the-counter products, with a pharmacist or geriatrician. Even something as routine as a nighttime allergy pill could be silently undermining memory and mental sharpness. Awareness is key to safer, smarter aging. Proton pump inhibitors (PPIs) are among the most commonly prescribed medications in the United States, especially among adults over 60. Drugs like omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix, are used to treat acid reflux, GERD, and stomach ulcers. While effective in reducing stomach acid, these medications are not without significant long-term consequences for older adults, and they are often overused. One major concern with prolonged PPI use is nutrient malabsorption. Stomach acid plays a vital role in absorbing key nutrients like calcium, magnesium, and vitamin B12. Suppressing acid production too much can lead to deficiencies. In seniors, this can translate into brittle bones, increased fracture risk, and symptoms like fatigue, muscle cramps, and even memory problems due to low B12 levels. Additionally, PPIs are linked to a higher risk of chronic kidney disease and dementia in several large observational studies. While these associations don't prove causation, they raise valid concerns, especially since many seniors stay on PPIs for years without re-evaluation. PPIs also increase vulnerability to gastrointestinal infections like Clostridioides difficile, a potentially life-threatening condition in older adults. Another issue is that many seniors are prescribed PPIs just in case, or continue using them long after the original issue has resolved. For example, someone who was prescribed a PPI after a short hospital stay might continue taking it indefinitely without reassessment, simply because no one ever followed up. What's the alternative? For mild reflux or occasional heartburn, lifestyle changes such as avoiding late-night eating, reducing alcohol and caffeine, and elevating the head during sleep can help significantly. Antacids or H2 blockers like famotidine, Pepcid, may also be safer short-term options for symptom relief. If you're over 60 and on a PPI, don't stop suddenly, but do talk with your doctor about whether you still need it. A step-down approach, possibly tapering to a lower dose or switching to a safer alternative, can protect your bones, brain, and kidneys while still managing your symptoms. The key is informed use, not indefinite use. Many seniors struggle with sleep, and it's no surprise that sedatives and sleeping pills like salpeter, Ambien, benzodiazepines, like lorazepam or diazepam, and over-the-counter sleep aids are widely used by people over 60. However, while these medications might seem like a quick fix for sleepless nights, they come with a hidden cost, particularly for older adults. Benzodiazepines and Z-drugs, like salpeter, work by depressing the central nervous system, promoting drowsiness and sleep. But as we age, our bodies metabolize drugs more slowly, making us more sensitive to their effects. In seniors, this can lead to daytime drowsiness, confusion, dizziness, and impaired coordination, all of which significantly raise the risk of falls, fractures, and motor vehicle accidents. Even more concerning is the long-term impact on brain health. Multiple studies have linked prolonged use of these drugs to an increased risk of cognitive decline and dementia. Seniors who regularly take benzodiazepines are at higher risk of developing memory problems and reduced mental clarity. And because these effects develop gradually, they often go unnoticed until serious harm has already occurred. There's also the issue of dependence. What begins as an occasional sleep aid can quickly turn into a nightly habit, making it harder to fall asleep without medication. Withdrawal symptoms, such as anxiety, restlessness, and rebound insomnia, can make discontinuation difficult, especially without medical supervision. Many over-the-counter sleep aids also contain diphenhydramine, an anticholinergic drug that, as covered earlier, can worsen cognitive function in older adults. So even harmless products from the drugstore can quietly undermine senior health. The good news is that non-drug strategies are both effective and safer for long-term sleep management. Cognitive behavioral therapy for insomnia, CBTI, is considered the gold standard treatment and has been proven effective in older adults. Creating a consistent sleep routine, limiting naps, managing light exposure, and reducing caffeine and alcohol intake can dramatically improve sleep quality. For anyone over 60, especially those with existing balance or memory issues, it's crucial to review any sleep medications with a doctor. What seems like a minor fix may be silently affecting your health more than you know. As we age, it's common to accumulate prescriptions, sometimes 5, 10, or even more. This situation, known as polypharmacy, can be dangerous, especially for seniors whose bodies metabolize drugs differently than younger adults. That's why one of the most critical habits for people over 60 is scheduling regular medication reviews with a healthcare provider, at least once or twice a year. A medication review involves going over every prescription, over-the-counter drug, vitamin, and supplement you're taking. The goal is to ensure that each one is still necessary, effective, and not interacting negatively with other medications. For seniors, these reviews can literally be life-saving. Take for example Mr. Alan Green, 76, who was taking medications for high blood pressure, arthritis, sleep issues, and occasional anxiety. Over time, he began experiencing dizziness, confusion, and a few close calls with falls. After a medication review, his doctor discovered a combination of drugs that were amplifying side effects. Adjusting just 2 prescriptions made a dramatic difference in his clarity, balance, and energy. Medication reviews are especially important after hospitalizations or when seeing multiple specialists. Often, doctors prescribe new medications without fully knowing what others have already prescribed, increasing the risk of dangerous drug interactions or duplicate therapies. Seniors who regularly update all their providers with a current medication list reduce this risk substantially. Another benefit is uncovering hidden risks, such as medications that increase the risk of dementia, internal bleeding, kidney damage, or falls. In many cases, safer alternatives or lower dosages are available but simply haven't been considered. These reviews also give seniors a chance to reassess whether they still need medications that were prescribed years ago. For example, long-term use of proton pump inhibitors for acid reflux or NSAIDs for joint pain may no longer be necessary and could cause harm. For adults over 60, reviewing your medication list with a doctor or pharmacist isn't just smart, it's essential. It can mean the difference between years of thriving and an avoidable health crisis. Make it part of your wellness routine, just like annual physicals or vision checks. Your brain, body, and future self will thank you. Skipping or delaying essential health screenings after age 60 can lead to devastating consequences. Undetected conditions like high blood pressure, diabetes, or colon cancer often progress silently until they reach a critical stage, when treatment becomes more complex, costly, or even ineffective. For instance, osteoporosis may go unnoticed until a serious fall results in a hip fracture, drastically reducing mobility and independence. Missing routine eye exams could allow glaucoma to cause permanent vision loss. Without regular checkups, many seniors only learn about life-threatening conditions when symptoms become severe. In many cases, early detection through simple screenings can mean the difference between a manageable condition and a medical emergency. I'm Dr. Emily Carter, and here's my clear advice. Every senior over 60 should schedule their annual health screenings without delay. Prevention is far more effective and less painful than treatment. Simple blood tests, bone density scans, eye exams, and colon screenings can uncover silent issues before they become dangerous. I recommend creating a personal health checklist with your primary care doctor. Bring a family member to appointments for added support and clarity. Keep a notebook or use a digital app to track your screening dates, results, and follow-up care. Stay proactive about your health. This isn't just about living longer, it's about maintaining your independence, energy, and quality of life. Don't ignore subtle signs, and never skip a screening because you feel fine. Many serious conditions have no early symptoms. A few hours a year could save your life, or protect your ability to enjoy the years ahead with your loved ones. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update from Wellness 60 to 100. Share this with someone over 60 who cares about their health. And let us know in the comments, which screening have you scheduled this year? Stay proactive, stay informed, and age healthily.